Bubonic plague strikes. Arizona, the shocking case that demands health awareness. You might be surprised, but what I'm about to tell you didn't happen in medieval Europe. It happened just recently, right here in the U.S. in Arizona. A healthy man, no underlying conditions, not elderly or frail, suddenly died just hours after being admitted to the hospital. The final diagnosis? Pneumonic plague. No one saw it coming. Not a single doctor initially suspected the plague. And honestly, if it were me or you, walking into the ER with a mild fever and a bit of a cough, we probably wouldn't think of it either. But this death isn't meant to scare. It's a wake-up call. A reminder that health every day isn't just a trendy phrase on social media. It's something you live with or pay for every day. Part 1. The plague case in modern America. Picture this. You wake up feeling a little off. You're coughing a bit. You think, hey, it's probably the weather. You go to work, eat lunch like normal. But by afternoon, you're feeling worse. You go to the hospital. And that same night, you don't wake up. That's exactly what happened to a man in Flagstaff, Arizona. And the diagnosis that shocked the medical community: pneumonic plague. Why is this so alarming? Because pneumonic plague isn't just deadly, it's extremely hard to diagnose. It moves fast, so fast that even the best doctors might not have time to react. Part 2. A silent path of transmission. When I asked Dr. Dave Wagner, an infectious disease expert at Northern Arizona University, he said something I'll never forget. You may never encounter the plague in your life, but if you do, it's usually too late. He described a surprisingly common chain of transmission in the wild, a colony of prairie dogs. Fleas living on the prairie dogs become infected with Yersinia pestis. A dog plays in the woods, picks up one of those fleas. The dog comes home and curls up next to you. One tiny flea bite. And just like that, the plague enters your life. Even scarier. You might not get the bubonic form. You could get the pneumonic form. And in that case, you can spread it to others through droplets. Unless you're isolated in time. Part 3. Why bubonic plague is still dangerous in the 21st century. Someone once asked me, wait, the plague still exists? The answer is yes. It never really went away. According to the U.S. Centers for Disease Control and Prevention, CDC, there are anywhere from 1 to 17 cases of plague reported each year, mostly in western states like Arizona, New Mexico, and Colorado. Most of them are the bubonic form, the one that causes painful swelling in the armpits or neck. But when the bacteria reach the lungs, that's when pneumonic plague sets in, and death can happen within just a few hours. Part 4. Don't wait until you're in a hospital bed to think about your health. I spoke with Dr. Frank Lavecchio, a physician who once treated a suspected plague case firsthand. He told me about a patient who came in with mild fever, a cough, and some chest pain. Nothing too alarming. They ran an X-ray, gave him cold meds, and thought he'd be fine. But just a few hours later, the patient's blood pressure dropped. He had trouble breathing, and then he died. Lab tests later confirmed it was the plague. What haunts me most, the doctor said, wasn't how strong the disease was. It was how weak the patient's immune system had become. His body should have lasted longer. And he made one point very clear. Health every day doesn't start in a hospital. It starts with how you live every single morning. Part 5. So what should we actually do? Look, I'm not saying you need to wear a full hazmat suit every time you go for a walk in the woods. And no, you don't need to sanitize every surface in your home like it's a science lab. But what you do need is awareness. Know where you live. Know how you live. Ask yourself a few simple questions. Do I get my pets checked regularly? Have I noticed any dead rodents around that empty lot near my house? Do I wear gloves when I clean up the yard or do gardening? Have I been brushing off a stubborn cough, telling myself it's probably nothing? I'm not telling you to live in fear. I'm saying that if we live with understanding, with just a bit of awareness, then whether it's the plague or anything else, we give ourselves a real shot at surviving. Part 6. Health every day. It's a lifestyle, not a catchphrase. Health every day isn't about forcing yourself to go on a 5-mile run at 6 a.m. It's about eating a clean, balanced meal, going to bed 30 minutes earlier, noticing when your pet's behavior seems off, not ignoring little symptoms just because they seem small. It's about being present, tuned in to your own body and the world around you. I know, bubonic plague sounds like something ancient, like it belongs in a dusty history book. But as we've seen, it's still here. It's real. And what's scarier than the disease itself is living without paying attention to your health every day. So what about you? Have you ever even thought about the fact that the plague still exists? What are you doing right now to protect yourself and the people you love? Drop your thoughts or stories in the comments. I'd love to hear from you. And if you want more down-to-earth health stories that might just save your life one day, hit that subscribe button. Remember, health every day isn't something you start thinking about after you get sick. It's something you practice, starting today. You see, stories like this don't just belong in textbooks or on the evening news. They're reminders, deeply personal ones, that health is never something to take for granted. The bubonic plague may be rare, but it's real. And while we can't control everything that happens to our bodies, we can control how much we care, how much we pay attention, how much we show up for ourselves every single day. Health awareness isn't about living in fear. It's about living with intention. It's about choosing to listen when your body whispers, instead of waiting for it to scream. So tonight, as you wind down, ask yourself, what's one small thing I can do differently tomorrow? One habit I've been putting off? One reminder to check in with myself, with a loved one, even with a pet? Because the real danger isn't the bubonic plague. It's forgetting how quickly things can change and how powerful a little health awareness can be.